Hello everyone, this is Stephanie Hustis doing a presentation on the electronic health record, which is an evidence-based practice, and this is a specific application and discussion about dementia and about how nurse practitioners can be helped with this. Electronic health records is an evidence-based practice, and that data is findable through many resources on the internet. There's lots of information out there about the good, the bad, the beautiful, the ugly about electronic health records used, as there's lots of debate still going on, even though there's a lot of evidence that it increases medication safety and other patient care, facets whenever the prompts and everything on there are followed. There's lots and lots of programs out there that exist for hospitals, home health care, long-term care, hospice care, mental health care, even different therapies and dietary. There's lots of different programs that are more tailor-made for each of those, but even within those, there's subgroups. And that is why I say with all the advancement that's happened in electronic healthcare records, there's still a lot of work and a lot of specialization to be done. Electronic health records as it pertains to dementia care patients for the NP, the EHR is the consolidation or the centralization of the complete health information for the patient, their admission record, their demographics, diagnoses, their vital signs, any tests, lab tests, x-rays, any visualization studies, all of the results that are there, medications and how the patients are doing with their medications, any notes that the nurses put in, and it's important to note that for dementia specifically, that there are tools that can be used to find some undiagnosed cases, doing some retrospective studies, which we'll go into in a little bit. But there are concerns with the pushing through of the 21st Century Cures Act in the U.S., that it increased the accessibility of patient health information, which brings up some ethics concerns for nurse practitioners to be mindful of. But as it pertains to dementia, there is no specific electronic health care record that is a good fit. Customization, there needs to be some specialization, customization for dementia. And the good part, there are algorithms that can help direct clinicians to have their dementia care patients to be have appointments and have the families directed to taking them to specified clinical services. But the unfortunate thing for NPs to be aware of is that providers uniformly are not following those prompts for dementia patients, and the question is why. The tool that I mentioned earlier is called the e-radar tool. That's been used retrospectively to look for triggers and different things in patient records to diagnose dementia or cognitive decline in early stages. But even still, it's important to note for us that almost half of dementia remains undiagnosed. For any changes that happen in EHRs or any changes that happen in medication as a rule, the medicine machine is very difficult and slow to turn, requires dissemination and implementation for the new plans to take place, and that's going to take time and significant effort. The dissemination is going to involve social work, so rural sociology or just social work to get the word out, just to make the change known. And then the implementation of it is going to require some evidence for the evidence-based practice, because that helps to convince people of the authenticity and the value of the change that needs to be made. The facts of EHRs and the hope of improving dementia care. The reality is that as of 2022, there's 6.5 million Americans living with dementia, and most of those live in suboptimal conditions, like memory care units, locked memory care facilities, even hospitals, and sometimes in state hospitals. And the cost of healthcare for those patients tends to go up, and the outcomes tend to go down. So they're poor outcomes. And most dementia is diagnosed late, and families try to keep the dementia patients home as long as possible, and so the disease can be quite advanced before the patients are put into a residential treatment facility. The EHRs can be geared to give evidence-based practice recommendations, which then has a chance of improving dementia care patient outcomes and the overall quality of life for them when those recommendations are followed. With that e-radar or any other type of program like that can help to go through patient records and diagnose earlier, the hope is that the patient outcomes would improve, and that the long-term outlook for those dementia patients might be more optimal. The challenges in the application of electronic health record or recordings as it applies to dementia care is most of them are designed for general patient care, and most even hospitals that use them know that they're designed for general patient care. So there's lots of different divisions within hospitals and other treatment facilities that need customizability of the electronic health record, like the intensive care or the labor and delivery unit or the emergency room. I mean, pick a division within the hospital, and dementia is no different. It needs customizability. Lots of providers can have access to a patient's electronic health record, which can be good when there are specialists involved, but there can be concerns with the fact that the information is even more easily accessible for researchers. So there need to be some other safeties in place, some other protocols in place that protect our patients, and dementia patients are an especially vulnerable group. And with that data being able to be used retrospectively, that means that records can be used years down the road for even those of us now, and for nurse practitioners to even be aware that for the patients that they're caring for now, that there is a chance that their patients' records could be used retrospectively down the road for researchers to look for, in this case, early onset cognitive decline. But say 10 years down the road, there other tools are developed for other diseases. It's just important to be aware of that, because you'll have to be an advocate for your patients maybe years down the road. It's a good thing to be mindful of. These are the references that I found to support this presentation. I appreciate you guys watching this and even your responses to it, and prayers for success in completing of the program. God bless, and know that you are loved and prayed for. Thank you.